So this is being introduced around the state to help people who are incarcerated and those that would have mental illness and substance use disorder challenges. And this is started as a pilot program in 5 counties. And we're lucky that one of those counties from Delaware, the sheriff came down, talked with us about the program, how pleased he was, and what he thought the benefits were. And then this is Jamie Whitaker. Jamie has already been down and looked at our jail, talked with the sheriff's staff, and it's a possibility here. It's not a great facility. We all know that. But Jamie's the kind that tries to make things work no matter where it is. So we know that listening to this, it has the potential to change lives. And I know that all of you here today are in that kind of, I don't want to say business, but that kind of profession that you're wanting to do that as well. So I'm just going to turn this over to Jamie, but Jamie is not just the heart and soul of IRAX. I described you this morning as you are the spark, the fuel, and the oxygen. That's going to make this just really make a difference. So I'm going to turn it over to you, let you tell your own story. He's got a slideshow. We're going to open it up for discussion. So go ahead. Thank you.
One, it's such a pleasure to be here today. Thank you so much, Penny, for all the amazing work you do down here and for having us down here to work and meet with great providers in the community. I'm not on. Okay, we'll try this again. Again, it's great to be here. Thank you, Penny, for having us down. It's such a great community. I had a chance not too long ago to visit the jail and meet with the jail staff and get a chance to see the facility and talk with folks who were there. And it's such a great facility, and we're really excited to be here. If you want to go ahead and open up the PowerPoint, I'll get ready where I can start beginning talking about the program. My hope is to take a little bit of time to talk about IRAX and what it is, how we got started with the program, give a little bit more information, and then afterwards we can stop and have time for discussion and questions and kind of go from there. So if you want to go ahead and go on the next slide. So the IRAX program came from work that had been being done in a jail in northern Indiana. We did a program there for a few years, just trying to help individuals who were leaving the jail. We knew people were leaving that were needing help. We have people who are leaving jail who, as we all know, in the first few weeks are at much higher risk for overdose death and just different challenges that they may face. And we felt that getting into the jail and bringing people, especially peers, into the jail environment allowed us to build some relationships with people earlier on. The biggest thing that we say, and I think this is something we've learned throughout time, is if you want to make a difference with individuals, waiting until they leave the jail is too late. That reentry should begin at day one, at their early moments of incarceration, rather than waiting when they leave. So we did this program for a few years. It's funded by state government, state mental health agencies, and we had a ton of success with this program. So I moved to another agency, and in the fall of 2021, we were approached by the governor's office and Division of Mental Health and Addiction, and we're very grateful to have incredible leadership here in our state and visionary leadership. And their question was, with the success you had in this program, would it be possible to take this program if the leadership in our state would be willing to put some funding behind it and create some pilot programs to see, could it be as successful in other counties as it was in the county where we began this program? And of course, we were very excited about the idea. All of us here at Mental Health America of Indiana love being a part of visionary work, love being supportive of visionary leadership. So the idea that they wanted to expand this program was absolutely something that we were supportive of doing. So we began working on the idea and looking at what we had done successfully before, what would we do if we had more funding, what could we do and have done better. And through the process of that, we created a program that we call the Integrated Reentry and Correctional Support Program, or IRAX. In June of 2022, or actually in the fall or in the spring, we began to go around the state and interview sheriffs and city and county leadership and criminal justice partners and our executive leadership from the communities and prosecutors and public defenders, and began to talk about and look at what would we feel like we would need to have in a community to make it a place where IRAX could be successful. And so we began with those 20 counties, and we ended up narrowing it down to about 10. And then throughout getting close to summer, we had narrowed it down to about 6 counties. And we decided to start with 5 of those counties here in Indiana. So in June of 2022, we got those 5 counties together and we began our training and development. And we spent a whole month of training all the providers that are going to be collaborating in the program. So we work with our criminal justice partners, we work with our city county leadership, we work with law enforcement and correctional staff in the jail, and we make sure that everybody understands what IRACS is, how it works, and then we have a whole bunch of questions that the community needs to answer to make it culturally relevant to their community and to the work and needs that they feel like are relevant to their community. Next slide, please. We knew there were various components that were absolutely essential if IRACS was going to be successful in a community. The first thing we knew, I mean, obviously, if you're going to go into a sheriff's jail and you're going to provide a program and services and bring people in jail, you need to have his permission and his. We need to have a sheriff that it's visionary, that really wants to make a difference and an impact, that's willing to get outside the box and try things that have probably never been done before. So we knew that was a necessary component for IRACS. The second thing we knew it was important was having enough space in the jail to where we could have a full team of people working with people every day. The IRACS team operates in the jail 40 hours a week. So Monday through Friday, from morning till night, you have a whole team of people working in the jail full time. So we knew we need to have space. The third thing we need to have, obviously, is city and county leadership that were visionaries and really had a strong vision for recovery and what they want to see and accomplish in their communities. Willing to support IRACS and believes in the mission of what we're trying to accomplish with the program, and then willing to say, is there ways we can put either city and county funding behind some of the projects and programs that are going to be there. Another thing we need that was absolutely essential, IRACS was developed and created to work around the sequential intercept model, the SIM model. And so in order for a SIM model to be effective, obviously with SIM 2, 3, and 4, which is what IRACS was created around, you're going to have strong collaboration and support from your criminal justice partners, because that's where a lot of the work is going to happen. It's going to happen in the courtrooms. It's going to happen in relationship to the prosecutor's office and the public defenders. It's going to happen in collaboration with community supervision and community corrections. And then obviously your judges are going to have to approve of what's being done and not being done. And then it's also going to happen in the jail. So having strong criminal justice collaboration and vision and being willing to say, hey, this is our program, we really want to invest in this, was an absolute essential component. And then the last component, and most certainly not least component, is having a successful recovery community organization in the community. So having people in recovery who have formalized themselves together in a formal organization, and then being willing to be and provide peer coaches to be trained and certified by not only the state, but also my team, to be able to go into the jail and perform the program and provide services and supports, and then collaborate with all your criminal justice partners. So those are the 5 components you have to have in order to launch an IRACS program. And we call that our readiness survey, or the components that would be needed for readiness for IRACS. Next slide, please. Our partnership and looking at those recovery community organizations, we partnered with Indiana Recovery Network, and that's a statewide organization that provides, it was again created by our visionary leadership here in Indiana, to provide an infrastructure here in the state for resource centers and peer supports and navigators here to provide resources and people in recovery to provide support for people across the state. So we try to look at that IRN infrastructure, or that RCO infrastructure across the state, and provide supports and interactions with those individuals when we're looking at resources for IRACS. So one of the things we started out with 5 counties. It was Delaware County with Sheriff Tony Skinner and an organization called PAST. Scott County with Sheriff Jerry Gooden and an organization called Thrive. Dearborn County with Sheriff Shane McHenry and an organization called CERT, or One Voice. And Davies County with an organization with Sheriff Gary Allison and an organization called RISE, or Davies County Peer Recovery. And then in Blackford County with Sheriff Jim Heflin and an organization called PASS. Those were the original 5 pilot sites that we launched in June of 2022. And July 7th, we actually went live in the jail, and it was an absolute amazing experience over that first 4 years, launching these peer teams inside the jails in collaboration with the correctional partners. Next slide, please. There were 3 components, again, as I talked about earlier, that were essential for IRACS. One is the sequential intercept model. We continue to build intercepts across the intercept model. And the biggest thing we're trying to accomplish here is we're trying to create new opportunities for all the partners involved in the justice system to think of new ways to create change and create support for people that maybe we haven't thought of. Is there ways to do something differently? Is there a way to approach things? If we have peers, if we had more people doing more work, how can we have different discussions and different interventions? And what would we like to do in these different intercepts? If we could do what we want, what would we do? And so those are really the conversations we had throughout that first year. Sometimes we thought, it's amazing to watch what has been accomplished in these 5 counties over the last year, the impact it's had on their criminal justice system. We had some partners at the beginning of IRACs that said, we're not interested in collaborating with this whatsoever. And then by the end of the grant cycle, those were our biggest advocates. Some of the biggest advocates. So it's been incredible to watch just the criminal justice system at large do such amazing work over this last year. The second thing that's absolutely essential is having certified peer supports. So I'm a person in long-term recovery. I'm someone who would have been probably served in this county had I would have been in your courtrooms had I grown up in Bloomington, had I grew up in this community. You would have saw my face a lot. And we have so many people in the IRACS program. The entire teams in each county are all people in recovery, all people who have at one point in time been justice involved, at one point in time struggled with addiction and mental health, at one point in time really felt like their life had hit a bottom and had found sustained long-term recovery and had been trained and certified by the state and trained by my team and other teams to step into places. And I will tell you, I think Penny just said this earlier today, it's so surreal to watch people who used to be housed in a jail walk back into that jail and be in there providing support and encouragement for other people. Or for someone to say, I just heard someone say like 2 weeks ago in one of the counties I was in that I got sentenced sitting in that chair right over there. And then now here it is, 9 years later, now he's sitting over on this side and he's advocating for people who are currently wearing jumpsuits in the jail. And he's advocating for change and hope and recovery and treatment and the different things that people need. So those kind of things, that's why we believe certified peers are such an incredible part of recovery ecosystem and treatment system as a whole, but also really great partners in the criminal justice system, which is not really their normal forte. So we've created an opportunity for those peers to interact across the board in every facet of the criminal justice system. And the last part is what we call our engagement pathways. So the one thing that's really unique to IRACS is that we created a pathway so that no matter what forward progress someone is going to make through the criminal justice system, which is decided by the outcome of their criminal justice process, we have a resource, we have a process, and we have people who are able to engage with them in that way. So next slide, please. We have 5 levels, or what we call engagement pathways in the IRACS program. So level A is our pre-sentence, or what we call our sentence world. So for individuals who are in jail and probably going to be in jail for an extended amount of time, we mark those individuals as a level A. For people who are going to be leaving the jail in the next 30 days and going into reentry, what we call community reentry, we call them a level B. And so we mark them as a level B once we realize that's happening. For people who are level C, we know that once an individual is sentenced to the Indiana Department of Corrections and they're going to spend an extended amount of time in one of the prisons here in Indiana, they have a whole host of needs that are going to come up. They have a family they're leaving behind. Maybe they've never been to prison before and they don't know what to expect. So we collaborate very closely with the Indiana Department of Corrections and RDC, and we make sure that we're collaborating with them. That information is getting passed on. They know who this individual is and what their needs may be, and that we're helping people prepare to go to prison and do something that they probably don't want to do, and helping them understand that although this is definitely not what you would have chosen in your journey, it doesn't mean that this is the end of your journey. And so we can make this a positive progress step. We can make sure this is a part of your recovery process. Level Ds are people who are getting released on either bond or conditional release. We have a lot of folks who get arrested on a Saturday and they bond out on Monday, or arrested on a Monday and they go to court on Wednesday and they get released. So we don't have time to work with those individuals. And so we need to make sure that we identify which people we didn't have time to work with. We pass them on to our community team so that someone out in the community can reach out to that individual and try and get them on the radar and see what kind of help and support, encouragement, and resources they may need. And then our last, because everybody has free choice, this is America, and we have a level E, which means they can decide they don't want any resources, they don't want help. And so once we do that, we mark them as a level E. So our level B and our level D are very, very similar in the sense that they're both reentry. Those are people who are leaving the jail and going into the community. The difference is the level Bs we have time to plan for. We know they're getting out in 30 days. Our coaches work with everybody in the jail, make sure they have insurance. We try and get them an ID. We put an application in for a social security card and birth certificate. We look at the different resources they may need: housing, food, clothing. We make sure that resource sheets are getting off to the court. So the court, when they're going through their criminal justice process, the court is aware, and all the judicial partners are aware of all the resources that are available for that individual when they're making decisions about what they're going to do with someone. They know, here's all the things we can help John Doe get, or Jane Doe. Here's all the things we can get. And then when they leave jail, we have peers that meet them at the door, and we stay with them during that first 30 days of reentry every day. We walk with them the whole journey, and then they get transitioned to our community team, and the community team will stay with them indefinitely. So from the early moment of arrest through years after reentry, they can have a peer coach that walks with them every step of the way. And those peer coaches are trained and have access to resources on a whole host of resources across the system. Next slide, please. So some of the things that we knew we needed to focus on to make IREX successful is early intake support. And as we said earlier, reentry begins at day one. So we meet with everybody upon their arrival in the jail, and we take time to learn about their story. So what's going on? Like, tell me what's really happening. Now, the interesting thing about peer recovery coaches, and one of the things I think that makes them so effective, as someone in recovery, when I sit down with someone who's in the jail, there's an immediate connection that we make, because they know they can tell that I've been where they are. They can tell that I've walked that journey. So there's an intimate connection that like an almost instantaneous connection you make with people that just brings down all the alarms and all the barriers and allows you to have a deeper conversation and a personal conversation. So we do that right at the point as early as we can in the arrest process. So as soon as they arrive at the jail, we're having that conversation. We're looking at criminal history. We're looking at their background. We're looking at treatment history. We're looking at their natural supports. We're looking at all the things that may help them and help us understand the story of the individual we're trying to help, and then figure out what can we do, what resources can we provide, and then how can we communicate that to all of our criminal justice partners so that everybody knows what is available for this individual. We learn things about folks that we're able to share with our criminal justice partners a lot of times that people weren't aware of. Like, I didn't know that, and so we find that a lot. So the point is helping to gain a better understanding of that story and then communicate that in a way that helps everybody be on the same page and know what this individual may need, or what they may be facing, or why exactly is they landed where they were beyond the charges that they have. I was charged with lots of things during my time in the criminal justice system. I don't know that any of those charges defined me whatsoever, and they most certainly didn't define the story that I was struggling with. And when I finally overcame my story later on, it had nothing to do with the charges I had committed or what reasons landed me in court. It had to do with the childhood I went through, or the things I experienced, or the things I was struggling with. So those were the things we're trying to overcome. The charges are just what brought that to everyone's attention in the process. So integrated pretrial and community collaboration, all of our IRAX teams collaborate very, very closely with the courts. We work very closely with any pretrial providers in the criminal justice system, and try and do everything we can to make sure that the work we're doing and how we're leveling people in the IRAX program is relevant to what their outcomes of their criminal justice process will be. So not that we're trying to direct anything whatsoever. We're just coming in on the backside once the court says this is what we're doing with this individual, and figuring out how we can help that person be successful. Ongoing one-on-one and group support. So while someone is in jail, they're going to have access not only to that intake process and that coach that wants to connect with them, but they're going to get one-on-one support the entire time they're in jail from our peer coaches. And then they also get opportunity to attend either a peer-driven substance use group called Matrix, which focuses on substance use. It's about a 6-month-long program. And they're going to have access to what we call our RAP group, which is a mental health group. And it's peer-driven as well. And so we get a chance to come and talk about their mental health if they want to, and open up and learn new things about mental health and trauma and all the things that may impact someone who struggles with either mental health or mental illness or trauma or SMI. And as well, being able to interact with the substance use group that we provide in the IRX program. A comprehensive jail-based treatment. We collaborate with all of our treatment partners in the community. So Every peer team, it's part of our job to be kind of resource experts. So to know who all is providing what services in the community, create lists for those services, and then interact with every treatment resource we can and try and build those collaborations, get people into outpatient treatment once they leave jail, make referrals for people who want to go into inpatient treatment or some other kind of treatment out in the community. Anything we do all the resource. Every team has a resource navigator, and all they do 40 hours a week is gather resources around people. And that's all they do. Reentry, recovery planning, and crisis planning. As I said, every team has a reentry peer that focuses on providing support people as soon as they leave jail. And I'll talk a minute about what we learned about having interactions with coach and what we learned about recovery planning, because we've tracked a lot of data over the last year and tried to look at when people left jail, when we had time to plan with them versus not having time to plan with them, our level Bs and level Ds, what was the difference between their success rate of staying engaged and what made a difference. So we'll talk about that here in a second, but making sure that we have strong reentry, recovery, and crisis planning when people leave, having that plan in place is absolutely critical. And making sure that that plan includes everything that the court says you're going to do, as well as all the things you're choosing to do. What do I want to do with my life? What kind of changes do I want to make? What kind of resources? Transitional peer support, again, we're going to make sure that we monitor everything for 30 days after release to make sure that we're providing support people at some of the most critical moments and when they're facing some of the most dangerous moments of reentry. And at the same time, we're going to make sure that we hand them off to that community team. So there is a true warm handoff. There is no way for someone to drop off the radar that we don't know they dropped off the radar. And then ongoing peer support, having the ability to have a community team that can take them for 2 months, 4 months, 6 months, 2 years, 3 years, that they can be a part of a recovery community and ecosystem. And that positive environment is what we want to create. One of the things I think that we didn't plan on when we started the IREX program, I went into those jails early on. And then when you go into those jails now, it is not even the same universe as what it was when it started. When you go into the jails now, it's still a jail. It still sounds like a jail. It still smells like a jail. But when you go into the pods, when you talk to people now, they're talking about recovery. They're focusing on recovery. A lot of them are very excited about, hey, maybe if I successfully continue to move forward and get out of the criminal justice system and get my process moving forward, stay strong in my recovery, I can come back and be a coach and work on the IREX program. So this year, we have already, by the end of the grant cycle, we're working on year 2, like almost 2 years into the deal. We've already started hiring graduates of the IREX program that are now working at admin roles and other roles within the IREX program. So people who were in jail, got released from jail, found successful recovery, went through the process, were able to get certified at that year mark of recovery, and then coming back in now being trained, and then now they're providing support to other people out in the community. So it's a really great process to see that ecosystem continue to grow. Next slide, please. So each one of our teams, as I said, I'm not going to spend a lot of time on this slide. I've covered a lot of this already, but each team has a peer supervisor. Each team has a forensic peer that does all the intake and all the one-on-ones. Each team has an engagement coordinator. So all they do all week is teach groups. They do the matrix group and they do the wrap group. So from Monday through Friday, all that engagement coordinator does is lead groups every day. Each group has that reentry coordinator. So that person who's meeting them at the door and doing the crisis planning. Each team has a resource navigator. So again, that person who's just getting resources, all they do is wrapping housing, food, clothing, all the stuff they need. And then every team has an insurance navigator. So making sure that when people come into jail, the first thing we're doing is trying to sign them up for insurance and make sure that they have that insurance while they're in jail. It's paused so that when they get released, they can get their insurance activated pretty quickly. Next slide, please. So during the first year, and this is I love this information, and it shows the incredible work that has been done by our local communities and by our peers across the state. So we supported over 5,000 people in the IREX program in the first year in these 5 counties. We were able to provide over 6,000 intake surveys. We provided, when you think about that, I love this number, almost 28,000 one-on-one interactions with people during that year of time between those 5 counties. 6,000 group engagements, over 12,000 referrals and resources provided. Our success rate, so measuring how many people stayed engaged during that first 30 days, during the most critical time of reentry, We looked at the level B and level D, and we measured that time. At the end of that 30 days, they get discharged and moved on to the community team. And so between the 5 counties, we had a 75% successful completion rate in that first 30 days. So it means that everybody went into reentry. We had 75% of those individuals stayed engaged that first 30 days and continued working on their recovery plan. And then we looked at recidivism, which we didn't measure recidivism until the end. And it's really hard to identify, like, what is recidivism? How do you define that? So we make it super easy in the IRAC program. We don't get really complicated. I'm not a very complicated person, so I want it to be simple, small words. And so what we simply said was, if you've been in jail before and you come back to jail again, that's recidivism. It doesn't matter how long it's been. It doesn't matter what it was for, PTR, sanction, new charge, whatever it was. If you come back to jail, that's recidivism. And we measure that. We mark it for each people. We also look at dual discharges. And the 5 sites, our average recidivism rate, people coming back to jail, was 19%. And then our average jail population, when you look at the jail populations at all 5 jails, we saw, and again, jail populations kind of fluctuate. They go up and down. And we have not measured this over years. So again, we only have 1 year's worth of data, but in the 1 year's worth of data, we saw an average 23% reduction rate in population. So we've seen a lot of people getting out of jail. And more importantly than all this data here is talking to the sheriffs and talking to the corrections officers and talking to people in the jail and saying, what are you experiencing? So I'm going to tell you, next slide, please, some of the things that we found out during those times. So we kept interviewing all of our criminal justice partners and our city and county leadership and all those people on that list that I talked about earlier throughout the first year of the grant. And what we learned is everyone said that they felt like having peers involved in the work, that it raised collaboration level and communication, that they were communicating more. They felt more informed because the peers were making sure they shared more information on an ongoing basis. So I felt like it strengthened communication, coordination, collaboration. The sheriffs and then the correctional staff within all 5 of the jails have said they felt like it reduced critical incidents. So suicidal ideation, fights, other things in the jail. They felt like they had a reduction in critical incidents in the jail. The stress level of all 5 sites said that they felt like the jail staff felt like, I'm less stressed out because of having an IRAX team here. So the corrections officers felt like their jobs were better and less stressful because they had an IRAX team. And the people inside the jail, the atmosphere really has changed. And I really mean that. I mean, I wish I had a sheriff here to talk to about it today, but I know you guys had Tony Skinner came down a while back, and he's one of our IRAX pilot sheriffs. And they talk about the ecosystem change in the jail, or the atmosphere change. And then we saw increased recovery community and reduced stigma. So more people talking about, yes, I'm struggling with substance use, or yes, I'm struggling with this. More people being willing to come forward and say, I don't know if I have the answer. I don't know what I'm going to do. I need help. And so the more we have people coming forward, being willing to talk about the things they're struggling with, the more opportunity we have to meet those needs. So next slide, please. Every individual, we've been very blessed. Again, I don't want me to keep harping on about our state leadership, but we were very blessed that the governor's office and DMHA have brought in a tool, an evidence-based tool that is actually, it's a self-driven survey that individuals do. So our peers don't administer the survey. We're not clinicians. We just administer, we give people the computer. They're able to complete the survey. It's a self-driven survey that looks at PTSD, mania, hypomania, anxiety, major depressive, and substance use disorder. And what it does is it increases the complexity of the questions if people answer the questions in a positive way or a negative way, or it decreases it if they answer it in a way that doesn't seem like there's much of an issue. But you go through the survey, and at the end of the survey, on a 100-point scale, it gives you a likelihood of understanding if this individual would be able to be diagnosed on a mild, moderate, or severe category for these different 5 conditions. And so we give all those surveys to everyone in the IRAX program, and then we're able to compile that data and information and learn about what have we learned about. One of the things I learned in the jail when we first launched the IRAX program, it was I would ask sheriffs, how many people in your jails do you feel like are struggling with substance use disorder? And we'd ask our criminal justice partners in the courtrooms, how many people do you feel like coming into court are struggling with some form of substance use or mental health challenge? And we always hear like 85%, 90%. Some of the answers I got was everybody, like we'd hear all these kind of answers. But when we talk about it, we had no way to correlate, like, well, what's the actual numbers? Is it really factual? Is everybody able to be diagnosed with substance use disorder? So we really didn't have answers for all of that. So thankfully, because of this tool and that the governor's office and DMHA have provided for us, we were able to measure all these different categories with individuals through this impression survey we did this year. So what we learned was, and it was really interesting, 41% of the individuals in our jails from December 1st to the end of the grant program were present with moderate to severe symptoms of PTSD. A little more than 1 out of 3 participants showed moderate to severe signs of mania at 30%, anxiety at 34%, major depression at 44%, and substance use disorder at 47%. Now, the interesting thing here, and I've talked a lot about this, and I'm not a clinician, so I don't know if I can speak super intelligently about this, but what I will say is, if you have a sheriff that says everybody struggles with substance use disorder, right? And we hear that a lot. And when you see that in the charges, a lot of people who have substance use related charges, but yet only 47% of the people in the jail was able to be diagnosed with a mild, moderate, severe form of substance use disorder. So what it means is we have a lot of individuals in the jail who are struggling with untreated mental health challenges that are self-medicating with substances. And so it's not no longer a matter of asking or saying this is how it feels, this is what we think. We can look at the data now and say this is exactly what's going on in this jail. So our hope is as we launch the program in other counties like Bloomington or other places, this CATMate survey will be available so we can get a snapshot of our individuals in jail and what exactly is going on. And that data is available right at intake. So right when that we first meet with that individual, that information is available within 30 minutes after that meeting. Next slide, please. So some of the interesting things that happened, I talked earlier about trends, like what did we learn that first year of doing this work? One thing we learned is when you look at people who had an opportunity to engage with a peer coach and left jail versus people who did not have an opportunity to interact with a peer coach and left jail. So our level Bs versus our level Ds. When you compare those two people and two groups of people, what we learned was when we measured that success rate, that did they complete, did they follow that recovery plan, did they follow the court orders, did they follow those things leaving the jail? What we learned is if you had interacted with a coach or did not interact with a coach, you were 88% more likely to not be successful in that first 30 days versus the people who did. So 88% reduction or increase in your likelihood of being successful, right? Unlikelihood of being successful versus people who didn't. So there's showing that having a coach and engage with people is really, really important. The second thing we learned is that people who without a plan, so people who did not have a recovery plan when they left jail, experience a 66% reduction in odds of being successful in that first 30 days and staying engaged. So in that process, I mean, 66% and 88%, I mean, having are higher at risk for those if you haven't interacted with a coach and you don't have a plan. And so what we learned is having those things in place, having a really strong recovery plan, having resources wrapped around people leaving the jail with insurance and with someone who's going to walk with them every step of the way. If we provide that with our community, with everyone who's leaving the jail, we increase the ability and increase the chances that people are going to be successful and stay out of jail and not come back. And so that's what the data showed us last year and what we measured across the board. And I have this in a report form that I'm going to send to Penny, and Penny will send this out. I have a really short report for those of you who don't like bedtime reading. And then I have a really page-turning, long 26-page report that I'll send out as well that has a lot more of the data and much more explanations. But we'll send both those out to you guys after this is over. Next slide, please. So we had so much success last year. And again, I can't take credit for that. I can only give credit to our local communities, our judges, our prosecutors, our sheriffs, and all the great peers that are doing the work. We had so much success last year that, again, having great visionary leadership, they decided to expand that this year and give us funding for 6 new sites this year. So this year we are expanding into 6 new jails across the state. And I have spent the last few months and my team working to do the same thing we did last year, come out and evaluate communities, look at those 5 necessary components for IRACs. And we're in the process of launching 1 new site right now. And we're looking at launching 5 more in January, which is what brought me down here to check out the wonderful city of Bloomington, all the amazing people that I've got a chance to meet here. And for Penny being so gracious to bring me down here in this community. Next slide, please. And our hopes is through this process that we can accomplish a couple great things. One, we know that we cannot arrest our way out of addiction or mental illness. as someone who lives with long-term mental illness, and I'm going to struggle with mental health my entire life, not necessarily struggle, but when you have long-term mental illness, there's good times, there's bad times, but having to live with that, I live super successful with my mental health challenges. And it can be done if we can get the right resources around people. If we understand that story that they're really struggling with, I will tell you, I mean, no one changed me. What people did is they changed my opportunities to believe in myself in a way I never thought that I could, and gave me the opportunity so that I could make the right choices and move forward. And they stayed with me as I made all the mistakes that I was going to make throughout that process. So providing those resources and providing people, you know, if I'm going to go to Florida, it's much easier to get there if I've been with someone who knows how to get there. I've already been to Florida. And that's the strength of peer support. And that's the reason why it's been so successful. We already have so many great people and so many great prosecutors and public defenders and judges and prosecutors and probation officers and all kinds of other folks. And peer support helps those roles focus on what they're doing and also have a resource that they can utilize from people who've been there and who've walked out of those hard places. And we found that the more you partner those two groups of people together, really amazing and incredible things. I can't even begin to tell you all the incredible stuff that these 5 counties have done over the last year, the successes they found, the things we plan to do versus all the stuff they just did all on their own, and ways that they created new and exciting ways to meet needs. And they had the resources to do that, which makes that possible. So we're very excited about the work we're doing with the current sites. We're funding those same 5 sites this year and seeing what they do in year 2. And then we're also very excited to see what we're going to be able to do with the next 6 sites we're working with this year. And so we're hoping to continue to identify what those sites are and get those launched and see what we learn this year about this amazing community and all the things that can happen within the criminal justice system. So we're very excited. So does anybody have any questions? You want to do questions now?
I'd love to do questions. I think that I'd like to just give a little of my own perspective about something that about the peers. Many of you know I have an adult son with autism. He was identified when he was young. And for me to be able to talk to other parents of children with autism was so comforting, and so that they understood. And yet one of the other things that we said was, if you know one person with autism, you know one person with autism. It doesn't generalize. And one of the things I love about the IREX program is that it is completely individualized, absolutely individualized to meet those individual needs. And I think that's part of the reason that you're seeing the success that you are too.
Yeah, I'd agree. Absolutely. Absolutely. Everybody's story. I mean, I've had interactions. I still talk to my probation officer, and I feel like I should almost call her aunt or something, because she's been in my life since as far back as I can remember. But I still meet with her and talk with her on a regular basis. I mean, she's an incredible human being. But again, when you talk to her, she'll tell you, and I don't know how many times she said this to me, getting to know me as an adult and learning my story. She goes, I wish I would have known that story when you were young, because what I would have done with you would have been totally different. So how do we get to that? You know, how do we get to that part when someone's sitting in a courtroom who's scared to death, who doesn't even, I mean, I told her, I said, don't feel bad about this, because I wouldn't have been able to tell you that story back then anyways. I didn't know that. You know, it took me years to learn that story and what that was. So that's what makes this work so hard, but it's also unique. And so this gives us an opportunity, like you said, Penny, to individualize what we're doing, and then to empower people to, you know, to try things in a way we've never tried before. And that's where that's where we learn new things. I've learned so much this year about stuff I never thought we would accomplish, and seeing, you know, I can't say enough things about so many people in this program. I could go on for an hour and tell you all the incredible things I've seen people do. I mean, judges and prosecutors. And I had a prosecutor that I met in one of my counties who literally told me, we're not going to work with you at all this year, just so you know very clearly. And I had no idea how to respond to that. I'm like, okay. And I just don't think he was a fan. And in his defense, I will say, I don't know that we presented what we were trying to do very well either at all. They were a little nervous. But that individual is our biggest advocate at this point. I mean, he's like our best friend in that community. But it took us time to win him over, because we had to show him what we're doing is trying to solve problems, not create them. And so it's been incredible to watch that journey over the last year. And I think more focusing on the people and seeing those individual successes, that's how we get there.
So what does this community have to do to convince you that we can IRACs here.
Well, the good thing is nobody has to convince me whatsoever. I have an advisory board that looks at all this. So there's a bunch of really smart people that are way smarter than me that look at all the information. My job is to come out and complete the readiness surveys and gather information, then take it back to the groups that are smarter than me. So that's one positive thing. But the biggest thing is, while we're here, these meetings gives me an opportunity to learn about the information about the community that's here, like what's happening within, when we look at the SIM model, I mean, are the criminal justice partners willing to try those new things? Is a sheriff willing to let a group of peers, some of which, I mean, in Dearborn County, and I'm going to call him out, Sheriff McHenry, the leader of the IRACS program in Dearborn County was arrested and sent to prison by the sheriff of Dearborn County. And now they both work in the IRACS program together years and years later. And so is the sheriff willing to be that guy? And the great thing, you guys got a great sheriff here, and great sheriff and sheriff's department. So are the people here in the community willing to have those hard conversations and think about things in a new light and partner with our peers and people in recovery? So those are the things, completing that readiness survey, which is I'm already working on down here. I've already met with the jail, had a great conversation with the sheriff here and his staff, and did a great tour of the jail. So there's 2 components there that were absolutely checked out, the boxes that were checked. And now we're down here meeting with criminal justice partners and city and county leadership and recovery people in recovery. And I'm going to be here for a few days. And so we're just going to keep going through the process. Yes, ma'am.
Yeah. And would you come to the mic so that they could capture it? Yeah. I'm sorry. I told Jamie earlier that the acoustics in this room are terrible, but also there are people that will be watching this later from the recording, and they can't hear things unless you speak directly into that mic.
Okay. Hi, my name is Linda Brady. I'm the Chief Probation Officer here. And I appreciate you coming to our community and explaining all this to us. I have some of my team back there. So I was wondering, are you going to be meeting with us as part of this process to figure out kind of what we've got going and the services and so on?
Absolutely. So we usually start with some community meetings like this. And then what I will normally do is I'll work with Penny and we'll set up some individual meetings with some of the judges and court partners. And like, again, I went out and met with the sheriff one-on-one with his staff and did the tour. And so we want to make sure we meet with everyone, give a chance to people to share what they think and what they feel like they need. And I take a bunch of notes and and then just trying that way we can complete the survey from beginning to end. And but I'll make sure we connect with everybody and everybody has a chance to share and connect. Absolutely.
Okay, absolutely. So you're absolutely welcome to come to our department. We're in 2 buildings, but we'd like to show you around and show you what our services are. I noticed on your sheet about collaboration partners, and one of the ones was missing was probation, and it did say pretrial, but we have pretrial as part of our program as well. And I know some of the other counties you've worked with so far are pretty small, don't have as many resources as we have.
I'm sure, yeah. Well, and the interesting thing that I've learned, and I guess I didn't know this when I started this, is that in some counties probation is considered community supervision, and in other counties it's community correction does this, and other counties are all together in one kind of.
And that's us. We're all together.
Okay, so it's like so hard to know exactly how to word all that.
Right.
Yeah, absolutely. We would love to come down.
Great. Okay. Well, thank you. That was what I wanted to be sure
absolutely.
To extend the invitation to come meet with us. And okay, thank you.
Appreciate it.
So I think you told me a while back that locally we would have to raise some of the money to make this possible. People earlier today wanted to know, what would the county generated money pay for?
That's a great question. So when we I don't want to use names, but we had a county where we came into, and they had peers, but they didn't have a formalized organization around that, right? And so if you want to help people who are incarcerated when they get out, you need to have people hold on to them in the community, right? And the criminal justice system, as you all are much probably better versed than me, is a very intense world. So our IRACS teams are literally trained to be experts as far as peers go in that criminal justice universe. And then we have a separate team out in the community that's meant to be an expert in that universe. So there's kind of 2 ecosystems that we support. And then there's a transition period in that 30 days where they're both working with that individual, but then there's a handoff that happens during that time. And so that process of that ecosystem and process of IRACS I have funding to fund the criminal justice portion of that process. What we normally, what I've asked communities across the state to do is if there's not a formal organization and a team hired to spend time being that community team, we normally ask our local commissioners and city county leadership to look at various resources. And we know there's some in various ways. And we try and have collaboration around, okay, what would that look like? What would the needs look like? It's different for a smaller county versus a larger county. What would the cost look like? Sometimes those resources are, hey, we're going to put some money, and every one of our sites have had commissioners or mayors or leadership who's invested in one way, shape, or form. Some organizations were already established in places and they didn't need to have that because they already had those resources in place. So it really just depends on the unique needs and current resources within that community. But then it also goes back to, the vision of, okay, if we have working with someone that has 200 people in a jail versus someone who has 500 or 700 people in jail, and what that need may be. So it's making sure that across that ecosystem that there's funding for that across the board, so that we can make sure that if we're getting people out of jail, we still have people there that are available to hold on to them. So we do an assessment with that piece in collaboration with some other state partners. And then we let the local community leaders and both city and county leadership know, here's what those needs look like. And here's the amount of funding we're going to provide for the criminal justice process of this. And here's the funding that would need to be there for the community portion of that. And that's usually what it looks like. That's a great question.
So the peer recovery coaches, both those that are working inside the jail and then the folks out in the community, do they all work for Recovery Works? Or how does that?
They all work under the RCO. So under that Recovery Community Organization, both those teams are peer organizations that work underneath their Recovery Community Organization. It's a formalized process. We have over 100 here in the state of Indiana. The state has a formalized process for developing that organization, certifying that organization, and funding those organizations. There's collaborations and trainings and all those things from across the state. Our state leadership has provided an enormous amount of resources to make sure that those organizations are able to set up, be formalized, and then being trained, and then being operated and supervised. And then we partner that organization with the sheriff's department, our criminal justice partners, under a contract with our organization on a state level.
It's good in that we met with some of the Thrive folks from Scott County last month.
So great. So great. So great. There's so many great organizations out there that have done great work.
So another question that we had earlier today is how you work with other programs that already exist. Absolutely. Either programs going into the jail or out in the community when folks have exited.
Absolutely. So one of the great things about IRX, and probably one of the unique things about it, is the peer team that's going in. I've worked in jails where I was kind of an outsider coming in, and that's normally how it operates. The IRX program is a part of the sheriff's staff. So it's like a part of his correctional staff. So we're in there all the time. It's not like an organization that's coming in as an outsider. We're a part of that sheriff's staff. So when COVID was going on and the world was shutting down, I was still in the jail every day because people are in the jail and they have needs, and so we're in the jail working, right? So we had that universe happening. So we want to collaborate with everyone, absolutely, positively everyone. Every one of our jails has different programs, like whether it be a mental health group that's happening, or an AA group, or a Bible study, or every jail has different people coming into the jail. We work with everybody and we work around everyone. IRX, with maybe very few exceptions, IRX doesn't duplicate what anyone does whatsoever. It's very uniquely focusing on the services we can provide to help reentry. And we work around all the other classes or whatever collaborations or trainings that are happening in the jail already. And then we partner with everybody. So our resource navigators and peers are meant to make sure that every program, every resource in the community is offered to the individuals in the jail. And since IRX doesn't provide any services in itself other than support, we're going to provide all the referrals to all those treatment partners and all those other people. So IRX itself is not a treatment provider. It's in the treatment spectrum, but it's not a treatment provider. So we're going to provide all those referrals to everyone, whether it be recovery resident or inpatient treatment or outpatient treatment or any kind of IOP or housing or food or clothing. The more resources we have, the more referrals we have, the better. because then it allows us to make sure we can meet all those needs for individuals that are in jail.
It's somebody else's turn to ask a question now. Mary, and please let Jamie know what your role in the community is also.
Hi, I'm Mary Morgan. I'm director of Heading Home of South Central Indiana. We're a relatively new initiative that's funded in large part by the county and the city of Bloomington to really drive long-term systemic change related to housing security. So housing and how can we strengthen the housing in this area. So I'm really interested in the piece that you talked about getting people connected with housing as one of your resources. As you know, that is a challenge for people coming with any kind of criminal record. And I'm heartened to see that you're already having folks work on some of the issues like insurance and ID and the documentation. But I'm curious about how you address those housing challenges when a lot of landlords just, do a background check and won't even continue beyond that process if someone has a criminal background?
That's a great question. So without me specifically talking about what we do with new sites, I'm going to talk a little bit about what our more mature IRAC sites are focusing on. Because I think we can start anywhere depending on where a community is. We'll start right where that community is at and try and begin to build resources. So some things we've done over the last couple of years is we've brought in new partners. So people who provide recovery residences, like let's bring in some partners. If we don't have enough of this, what resources are missing? I mean, the good thing about us is we're connecting to not only to state leadership, which has ridiculous connections and ridiculous relationships and lots of resources, but at the same time, we're also connected to local partners who are doing work and other IRAC sites who have found success getting outside the box across the state. So we want to have additional conversations on what resources can we bring in that are maybe missing, or are there resources out there we can bring in right now? Secondly, we want to look at making sure that we're connecting with all the resources that are here, provide as much education as we can to landlords. Like I know that in several of our counties, we brought landlords together with city and county leadership and had some great conversations around employment. Like let's make sure that employers know how can we keep people successfully employed if they're in recovery or having to check on probation on a regular basis, or having to leave work to do this or leave work for a drug test, or all the things that people may face when they're incarcerated or in reentry or in the criminal justice system. But at the same time, looking at what other resources are out there. So if someone's coming out of jail and they need a resource and it's not here, I have no problem traveling them or shipping them to another county so they can spend 6 months in a recovery residence somewhere where they can have that resource. Or can I get them to another treatment center because maybe there's not that resource here? Or maybe we have a pregnant mother. Okay, well, then we have a resource in Indianapolis. We can get that person that resource in Indianapolis so that they can have a place to find recovery even though they're pregnant and struggling with addiction. So, I mean, it depends on what resources the individual needs, but we want to have a strong understanding of what's available in the state of Indiana, and we have a lot. But at the same time, also understanding on a local organizational level, especially with connecting with our partners, what's there, what can we bring in, what can maybe we duplicate. We had some of our smaller counties that just didn't have a lot of recovery residences. So we partner with other places and say, hey, can we bring that resource in? And we have 2 counties that are in the process of working on that right now that were smaller. So, and then if there is no resource available, then where else can we plug them into another county so they can find that? And sometimes for other people, if their criminal justice process will allow, finding early recovery away from their county sometimes is a positive thing, getting away from all the who's, what, and where, and trying something outside of that community can be a successful way to look at it. So we want to try and have an expanded array of responses. And then again, in collaboration with the vision for the local community and what the community wants to do, we look at how we can build that out. And we're usually really successful at building a pretty strong resource database and knowing where those resources are. I hope that answers your question.
Yeah, it's heartening to hear, because even though we are, I think, compared to a lot of counties, resource rich, there are a lot of gaps, particularly in substance use disorder treatment and mental health services. So while we may have the services, you might have weeks or months to get on. And so that filling those gaps is really important. Yeah. And then the last thing I'd just like to get your insights on is we are looking at housing as a regional issue, because we see people who come here for various reasons to the population, but they're
It's awesome.
yeah. But some of the rural counties around us really need some support too. And I wonder what kind of collaboration between counties you see, and is that part of the model at all, so that there's communication happening?
Yeah, so we have one of our IRAC sites is a natural partner with a county directly. I mean, all of them are. We see that in every county. The counties around them, people are transient a lot of times in addiction and sometimes in mental illness, and so they find themselves in different counties and they get arrested. And we've had people in one IRAX county and then they end up in another IRAX county. So you see that transient moving. It's, you know, some of those challenges moving through. But what we've seen in some of our counties with IRAX is that because of the natural relationships and people who are in one county but actually end up in another jail or utilizing those resources there, we constantly work, and I think that all of our IRAC sites have continued to build MOUs with other counties and other providers and other resources and even other jails and other sheriff's departments. So we continue to see more cross-county collaboration at all of our IRAC sites. And it's different pretty much depending on where they are. We have one IRAC site right now that has actually just been in one county, and they're getting ready to expand to be able to represent both counties. So it's exciting to see, you know, those kind of collaborations, even though you have two totally different criminal justice systems, you know, that one team able to provide support. And then we have other counties like our past in Blackford and Delaware. It's the same organization providing support in 4, 5, 6 counties. And then we have Thrive in Scott County. They're in Scott, but they're also working in the Floyd County Jail and Clark County Jail and Jennings County Jail. And so you see organizations that may be located in one space, but they kind of, their ecosystem continues to get bigger and bigger, and so does the impact that they're able to have. So we always want to build that out and strengthen that as much as possible, especially where it's a natural kind of transition. And Bloomington being such an amazing city, but also such a huge city, I'm sure you kind of attract a lot of people from all over the region, I'm sure.
Well, thanks so much for your presentation. This is really exciting, and hopefully Monroe County will be part of the next program, and we look forward to partnering with you.
Well, I share that excitement as well. I do.
Questions, Eric? Prosecutor Relevant, sorry.
I don't have any questions. I look forward to seeing the written reports I'd like the extended version, please, when it's available. I just want to take a look at what you've put together. I mean, obviously, I serve on the Indiana Prosecuting Attorneys Council Board, and on that board are the prosecutors from Davis County and Scott County. And so I have a little bit of insight into the program from another source. So thank you so much for being here. And I do think it is a resource that Monroe County can benefit from. So thank you.
Thank you.
So how soon do we start the survey process?
In some ways, I think we already have. So when I went to the jail, I already completed the jail process. So that first 2 components I already completed here, and it was flying colors. So it's always fantastic. So yeah, so I think we're meeting today. I think we can. I will definitely be reaching out. I've got a list here already, and the list is growing, and so I know Penny and I will be reaching out to different folks, and I think I can guarantee you'll hear from me here over the next few weeks and try and get something scheduled. And I know you guys are very busy, but hopefully we can keep it moving forward.
Troy, Anthony, Counselor Munson, anything else that occurs to you? I mean,
thank you. We appreciate you being here. We're excited.
well, I as we were talking before people came in, one of the newspaper articles I read was about Delaware County, and the sheriff up in Muncie actually provided $50,000 of city funding to make this possible. But then Jamie said that they also provided $50,000 of in-kind, providing office space and utilities for staff. So I think that there are a lot of creative ways that we could think about doing things as well to make this a positive. And there was someone from the mayor's office here as well. We also, I think, heard very, very positively from the jail commander, Kyle Gibbons, and also from the chief deputy, Phil Parker. They are ready to put this program into place, it sounds like. And I don't want to speak for them, but it sounded like they would make the necessary space for this to happen.
Yeah.
I think we can.
I think when we met in the jail, I think we found some creative ways to find a way to make it work. So
Yeah.
That's exciting.
Yeah. And if we need other office space outside the jail, that's probably easier for us to, believe it or not, to find 1 or 2 offices. Are there other questions or anything you want to share with Jamie while he's here in person? The in-person is always more valuable for me than doing things on Zoom. And we do have one person attending on Zoom. Do you have any questions or comments? And I'm not sure who that is. If not, I thank everybody for being here. I really appreciated the questions as well. It just keeps getting richer all the time. And I learned new things today because when I was up in Indianapolis several months ago and heard you speak, you didn't have some of this stuff in place either.
Yeah.
So it does keep evolving for sure.
Absolutely.
Thank you.
Thank you.